Welcome back. We are officially kicking off year 2 of the Holistically Well podcast, and I am so excited. So, to recap season 1, aka year 1 of the podcast, when I sat down to record my very first episode, I was pregnant with my 4th child and didn't even know it yet. And I had decided before even knowing that I was pregnant, that first year of the podcast would be focused on the different seasons of a woman's life. So first, we really covered preconception. And with that included my years as a college student and a high school athlete, learning how to navigate and regulate my cycle. So in those first 10 episodes, I really shared my story, preconception health, how you can support it. And then from there, we dove into pregnancy. And what's really funny is I was pregnant and you got to move through my actual pregnancy with me. So I have specific episodes to each trimester of pregnancy, how to exercise through pregnancy, nutrition for pregnancy, and then how to optimally prepare your body for childbirth. That's a huge component of prenatal care that is so overlooked, and I am so happy to bring a voice to as a pelvic floor PT and mom of 4, because you really can reduce your risk of tearing. For example, I gave birth to an almost 10-pound baby 3 months ago with 0 tearing, 0. And I am 5'4", I am a more petite frame, and with my 3rd child, when I was in the hospital-based setting for my care, there were concerns about baby size and should we induce early, all of that. And my 3rd kiddo, I went into spontaneous labor on my own. He was 8.5 pounds, but born at 38 weeks of pregnancy. And so then my 4th kiddo, I had a week past my due date, and he was 9 pounds, 10 ounces. So I didn't tear with either of them. This just goes to show that you can be told you're going to have a big baby, and then they may be big and you may be just fine. So all that to say, that is kind of its own little entity of a women's health story. It's such a quick time frame when we actually give childbirth, but there's so much we can do to proactively prepare for it. So you'll find that when you look back on the episodes from season 1 as well. Then we get into postpartum recovery, which is what I've been moving through right now. I am now 3 months postpartum. My little guy was born on New Year's Eve, and I have just returned back to patient care for work. So now I'm navigating life as a part-time stay-at-home mom, part-time business owner, and full-time mom, because mom mode never ever leaves you. Podcasting has been a way to be able to educate other women and other families in a way that works for me in this season of life. I have been asked to do various speaking engagements over the years, and I absolutely love it. I'm actually somebody who loves public speaking, but oftentimes these types of presentations are on a Saturday morning or at 7:30 p.m. on a weeknight, and that is really hard for me to commit to, especially with a 3-month-old baby at home. I'm not wanting to say no to him, even if I'm wanting to say yes to these opportunities. So I'm really been having to weigh, like, a yes is also a no to something else. And so podcasting has been just this incredible, flexible way to be able to meet you where you are and to meet me where I am in this season of life. So if I think of how I like to learn as a busy mom, it's throwing in my earbuds, going for a walk, pushing my baby in the stroller or baby wearing, and learning as I'm moving, or listening to a podcast while I'm folding laundry during nap time. So I can meet you where you are, because so many of you are in similar seasons of life as me. If you're not yet a mom, you are commuting to and from work, you're able to listen to a podcast then or while you're out on a walk and get these tidbits for when you are. We also do so much proactive holistic health education on this podcast. So you will take something away from every episode, no matter if it's your specific season of life or not. That is feedback I have gotten from women who are in menopause and they're listening to these episodes and they're like, gosh, I take something from every episode, even if you're focusing on preconception or pregnancy or postpartum and I'm not in that season of life, I'm still taking so much away from it, which I love to hear. So first season of the podcast, you had 10 solo episodes with me, really diving into my story and preconception. Then we moved through pregnancy and postpartum. solo episodes alternated with guest episodes. So we got deep dives from incredible guests, such as the founder of Pluck Seasoning to learn about organ meats in our bodies. We got to hear from the founder of Masa Chips and understand the inflammatory impact of seed oils. We got to hear from the Women's Health RN, Jenny Noche, who does an incredible job breaking down PCOS and its effect on the body. So all of those episodes are a library for you to go back and listen to as you need it. Moving forward into this season 2, the layout's going to look slightly different because I want this to be sustainable for you to listen to and for me to consistently put out there for you. So every month, there is going to be 2 shorter episodes. I'm talking 5 to 10 minutes, and 2 longer episodes, anywhere from that 30 to 60 minute time range. One of those longer episodes is going to be with a guest expert. So keep sending me your guest expert ideas. I have some incredible ones lined up moving forward into 2026, but I'm always interested in your feedback and reaching out to guests that you want to see on the show. So 1 episode a month is going to be a deep dive with a guest expert on their specific expert topic. For instance, we're going to have a lactation expert coming up. We'll have cycle experts. We will have hormone health experts. So anything and everything related to holistic women's health is on the table. Next, you will get a deep dive episode with me. So anywhere from 30 to 60 minutes of me deep diving on a topic, such as how to return to running without leaking postpartum. That's one that will be coming up soon for you. Then you're going to get 2 shorter episodes with me, and they'll alternate. One is going to be office hours with Dr. Kayla. I get so many questions on Instagram, and I love doing those Q&As on stories, but there's only so much that you can do to answer something on a story slide and written text. So you get 5 to 10 minutes of me talking about a specific question that I get from one of you. I'm really excited about this. I get questions all the time that make me think, gosh, so many other people would benefit from my answer to this question, because I know the person who asked this question is not the only one struggling with this. For instance, a mama asked me about uterine twitching last week, and she wasn't pregnant, she wasn't trying to conceive, and she was just wondering, why am I getting these like muscle spasms in my uterus? Fast forward to this week, I had another patient reach out with uterine pain, and she's an athlete. So I see similar themes pop up throughout our community, and I want to educate you. I want you to know that you're not alone if you're feeling something. So if you have a question, drop it in my DMs over at Dr. Kayla Borchers. I'll add it to the list, and every month I'll be answering one of those questions on a quick Q&A style podcast, 5 to 10 minutes with quick action items that you can implement right away. It's that easy. The other shorter episode that you'll be getting from me every month is going to be titled Rooted Well. And that is where I will come up with themes that I have been noticing in my practice that I feel like you would all benefit from hearing from. And again, short, actionable episodes. This is going to make it so much easier for you to kind of binge these episodes. Let's say you go on vacation, you miss, 2 weeks of episodes. I don't want you having 2 hours worth of podcasts to catch up on. You can listen to 2 shorter episodes, you're caught up, and then there's 2 longer episodes for you to deep dive into when you have the time. I think this will be such a more sustainable way for you to learn with me and for me to stay consistent creating these episodes for you, because let's be honest, it takes time. And I'm a mother of 4, running a private practice, building our dream home, and raising 4 incredible children while also supporting patients in person 2 days a week in my office. So creating a sustainable framework for me and you is the goal. Now, to celebrate year 1 of the podcast, I asked you over on Instagram to submit questions, and I wanted to use today's episode to answer some of those so that we can keep this conversational, very personal, and rooted in what you are actually navigating in your life right now. So if you will, this kind of kicks off your very first Q&A with Dr. Kayla. now that you know how we'll be progressing into this new year of the podcast. So, one question that came across, and I've seen this repeatedly, is asking about my personal take on newborn care, utilizing chiropractic care versus massage therapy versus physical therapy. So, what are my thoughts or recommendations on chiropractic care, massage, physical therapy, etc., for newborns? This is such a good question. And as somebody who takes a proactive approach to health, I implement these as a mom. So keep in mind, I'm a physical therapist. So I'm able to do some of those physical therapy techniques on my child. Now, each of my boys have moved through the birth canal very quickly. And that in a way is a really good thing in terms of head shape. They can come out with like perfectly round heads, as my latest kiddo did. But the thing that we do see in kiddos who move through the birth canal quickly is tension. They kind of have almost a shock to the system of, wow, I was just up high in mama's belly and all of a sudden I moved through very quickly and now I'm out into the world. My child was born in the water, so I do think that really helps with that transition. But nonetheless, they can experience some tension. So I love proactively utilizing physical therapy, massage therapy, and then sometimes chiropractic care could come in. You just want to make sure they're utilizing a very gentle approach. So you can kind of pick your provider of choice and to just do an evaluation. Have them assess your child. Where are they holding tension? Are they really restricted in mobility? And have that provider show you exercises that you can do at home with your child. That is my biggest thing for you though. I would take caution with a provider who says, yeah, your baby has a lot of tension. I need to see them twice a week for, gosh, like probably 12 weeks to help alleviate that. That to me is a red flag. You, as their mother, should be the primary one doing some of that body work on them. And if you're not trained in it, I understand you're not going to know how to do that. But go to a provider who is going to teach you. So, for instance, my focus is on the mamas in my practice. I am mainly treating adults in my clinic. But when I have moms who are concerned about their child or want me to take a look at their kiddo, I will. And I teach the mom exercises that she can do on her own child. Okay. So you may get that assessment from a PT to learn movements, but then their nervous system is going to be most comfortable with you. They're not going to be fighting it like they would from another provider. So that's really my take on it. So for me personally, I do not bring my children to any of these professionals that were listed. Technically, they're seeing me, a physical therapist, but I'm also mom. So my recommendation would be go to your provider of choice, somebody that you trust. I think any three of those would be appropriate: a chiro, a PT, or a massage therapist, or I'd put craniosacral therapy in that category. Go get your evaluation. I think it's great to do it proactively. With my last two children, for example, I didn't have any concerns, but proactively, I started working on them because I knew of the benefits. And my second child, who was also born very quickly through the birth canal, I didn't do any proactive work on, and I started noticing the effects of that tension in terms of plagiocephaly as he was nearing like 3 to 4 months of age, because I just didn't know. You don't know what you don't know. So with my third and my fourth kiddo, I have proactively been doing body work on them. I have some reels for this on my Instagram page that you can look back on, but you can do pressure point release on little ones' upper traps. You can do like gentle hip mobility, some thoracic rotation stretches with them. I'll create some more content for you on this because I know it's a recurrent question. But yeah, I would really just focus on it on you as the mom, but you do want to learn from a professional and get your child assessed so that you know what to look for. You actually know what you're doing when you're doing the stretches, and then go from there. On the flip side, I mentioned like very quick deliveries. On the flip side, if you had a really long labor, if your baby was in the birth canal for a really long time, that's when you're going to notice like, oh, they came out with kind of a misshapen head. They're going to have a different type of tension, right? Because they might be really cockeyed because they were stuck in one position for a long time in the birth canal. That would warrant a different type of treatment, right? We're going to not be looking at it from a proactive lens, but from a, oh, I see tension here. We need to work on one side more than another. So again, that's where a professional's insight would be really beneficial. And then the other thing that could contribute to this would be positioning in utero. So for instance, if you have a frank breech baby, sometimes their hips can be where they have a ton of like external rotation and be really limited on internal rotation. So we might work with that baby in a different way compared to a baby who was head down for a long time in utero. So those would be my recommendations there. But again, take caution with a provider who only wants to see you repeatedly, but doesn't give you as the mom tools to utilize at home with your own child. If that's the case, I would find a provider who's going to help empower you and help put the care back in your hands, because you're their provider. They're going to be most comfortable with you as their mama. And then it's so fun to be able to do those movements with your own child and see the change. The next question that I got, and I got a few in this category, was what I do with my own kids in terms of sleep, nutrition, products, healthcare. So I love this whole wheelhouse. So my children right now are ages 6. I have a 6-year-old daughter, 4-year-old son, 2-year-old son, and 3-month-old son. And we, with our firstborn, started using Taking Care of Babies. I just followed like her free blogs to really understand sleep schedules. When parents are saying that their child is not sleeping and they are really, really struggling, I point them to this resource, because understanding how long your child should be awake, how long they should be going between feeds is very, very helpful. Not in a rigid way, but just in a rhythm and routine way. So for instance, my 3-month-old child now, his awake windows should be anywhere from like 60 to 90 minutes. Now, am I rigid and like, oh, it's only been 55 minutes, you shouldn't go back to sleep now? No, but it just gives that general understanding of, oh, you've been awake for an hour and a half and you're getting fussy. You're probably tired, and not like, oh, what's wrong with my child? Why are they fussy? I'm going to try to feed them again, even though it's been an hour and a half from their feed. No, like he just needs held tightly up here and bounced. Then he falls asleep. He was fussy because he was tired, and then I lay him down. So this can help, and in terms of a proactive approach, teach your kid good sleep habits early on. All of my kids have been really good sleepers overall, and I think it's because of habits we'd instilled early on. The other thing is like helping them connect their sleep cycles when they are little. So recognizing that those little newborn grunts that they make isn't always them waking up. It's just them transitioning between sleep cycles or them going through REM sleep. So if you get them up right away because you think that they're awake and ready for another feed, you're disrupting their sleep cycle, and it's teaching them that every time they're in REM sleep to wake up. And then that transitions to a toddler waking up in REM sleep and thinking, oh, I need my mom. I need to go to my parents' room, or I need to climb in bed with them. When in reality, they just needed to transition to that next cycle of sleep. Taking Care of Babies, we struggled more with my second child, like around the 4-month sleep regression mark, that I ended up buying her course too. And I do think it's a really helpful resource to have. It's virtual, so you can listen to it while you're folding laundry or your kids are napping or whatever. Holding your child, nursing them, and learn. But follow the wake sleep windows. She's got resources for that whole first year or two of life in terms of what you should be looking at: awake versus sleep versus feeding windows. But again, I'll stress rhythms, not rigid schedules. Okay. I was probably more rigid with my first than I should have been. It was like, oh, it's 7:30. We need to be at home. We need to do bedtime routine. Now I'm much more flexible. So to kind of go beyond the baby years into where my preschooler and my kindergartner are now, my 6 and my 4-year-old, something that we utilize with them that's been really helpful is the Hatch nightlight. So it has an app paired with it, and we put it where it comes on automatically at like 7:45 at night. It starts making white noise. It turns like red or purple. You put it on like a calming light color. And then they know that signals it's about time for bedtime. So we start our bedtime routine. They go to bed. The light turns green and switches to birds chirping whenever it's time for them to wake up, whenever they can get up. So what I like is it's a really soft noise that they can sleep through it. And sometimes we don't even have that noise come on, where the noise switches, the light color just switches. So let's say my child wakes up at 6 in the morning. They look at their light, they see that it's purple and not green, and they go right back to bed. They don't get up. Our light turns green at 7 a.m. in the morning and during the week and 7:30 in the weekends. My 4-year-old in particular, right when that light turns green, he's getting out of bed. We hear his little pitter patter and he comes into our room, or he comes out into the living room if we're awake. And I love it because they don't know when they wake up if it's 3 in the morning or if it's 8 in the morning, right? They have no idea. So they wake up, their light's green, they know it's an appropriate time to get up and get out of bed. Of course, they know if it's an emergency or if they throw up or if they're sick or whatever. Like, they come to us if they need something, if they're scared from a nightmare. But in terms of just waking up to start their day, they know if my light's not green, it's time to stay in bed. That's something we implemented as soon as our children transitioned out of the crib. So our 2-year-old, we haven't quite utilized it with him yet. He's still in the crib. We'll implement it with him soon. So I hope that's helpful from a sleep standpoint. Those are like my biggest recommendations for parents. And I know it's been helpful for friends that we've shared that with. Switching to nutrition, we as a family focus on whole food, nutrient-dense meals. My children are eating what my husband and I are eating. So I am not making them their own meal of packaged mac and cheese while my husband and I are having salmon. We are all eating the same meal together. My kids get packaged mac and cheese sometimes at lunch if, we have a sitter, things like that, just to make it easy. But most of the time, if we're having mac and cheese, we're having it as a family. And I've got shredded zucchini in with it, and I'm making it from scratch with grass-fed butter, things like that. So in our home, I really, really try to minimize synthetic derivatives of food. So one of those things that I look out for is folic acid. So folic acid is the synthetic derivative of folate or methylated folate. In some people, it can react inflammatory within the body, particularly if you have the MTHFR genetic mutation. I haven't tested my kids for any of that. I haven't even tested myself for it, to be honest. But it's just something that I like to be aware of and to know, okay, I want to keep higher inflammatory ingredients out of my family's household. The other thing would be food dyes. I'm looking at packages. If it has food dye on it, I'm not wanting it in my home. Something else that we look for are fillers. So you can just look on food labels. The longer the food label, the more ingredients it has in it. With every meal, I'm prioritizing protein, healthy fats, and minerals. My kids call it special water, but I'll put like a quarter of a packet of Element in their water, usually once a day, so that they're getting remineralization from water that we are taking out the harmful ingredients in. It's also removing some of those good micronutrients of magnesium, potassium, sodium. So adding some of that back in. So recognizing with all of this though, while in my household, I am minimizing ultra-processed foods, I am keeping a close eye on what is coming into my house. We are not perfect. By no means are we perfect. If you see us at a baseball game or a basketball game, my kids going to the concession stand, they're getting what they want. And I am just cringing inside, but I'm like, it's okay. It is okay to control the controllables. And when you're out and about, if the only option is something that you aren't completely fond of and you didn't bring snacks with you that time, or all of their friends are getting it, you know what? It's okay. Their bodies are resilient. And that is something that I do come back to in my approach to health, is more of that like 90-10 or 80-20 approach of 80% of the time I am in control of what my kids are consuming, and it is healthy, nutrient-dense food. 20% of the time, or less, honestly, they're having something that maybe isn't great. Once a week, maybe they're getting something from a concession stand that I don't love the ingredients of at all. Or once a week, they're getting something at school that somebody brought in from their birthday party. Maybe it had food dye in it that I just wasn't aware of, right? That's okay. Don't stress about it. And honestly, having little bouts of their immune system and their body learning how to process those substances that aren't great for them is a good thing, in my opinion. And this is something where different people have different opinions on it's a carcinogenous substance. They shouldn't be exposed to it at all. okay, but if you're never ever exposed to something, then when you are, your body is going to react even more intensely, and it can trigger a greater inflammatory response in the body versus smaller microdoses that the body recognizes as a foreign substance and is able to get rid of really seamlessly. So that's kind of my take on it. I do not stress about making things perfect. I am very strict on controlling our home environment with nourishing foods, that those are the norm. And with my kids are like, well, why don't we have XYZ, like what somebody brought in for their snack at school today? I'm like, well, this is why, because it's not healthy for your body. It's not helping you grow big and strong. You know, we talk about how the foods that we eat are fuel for their body and helping them get stronger and to grow, and that there's some food that it tastes good, but it's not doing anything to help their body. And they're like, okay. And then it just rolls right off. But to me, I don't want my kids, when they are in a school setting or at a birthday party or things like that, to be standoffish to what other people are choosing. And so I'm okay with them having something, even if it's not what I would choose. And I think that builds resilience, and I think it builds a attitude of gratefulness towards whatever somebody's giving them, if that makes sense. So I'm kind of a sentimental person in that way. I'm like, I don't want to ever act like, oh, what you're giving me or my kid isn't good enough for us. Like, I don't agree with that. Anyways, I kind of got into the weeds there with that one, but it's something I feel passionate about. And I think there's just there's a lot of noise out there. And as a mom, you could just feel like, gosh, it's impossible to be perfect, right? And the way it is. And so stress is going to more negatively impact your body and their body more than having a package of candy that you don't think has great ingredients, because it doesn't. But to me, like the emotional load and component and the mental health component needs to be brought into play too, not just the nutrient component and the physical health. So that is kind of how I approach it. Okay. I keep nutrient dense whole foods in our home. They've got a whole drawer of healthy snacks that they can pull from. They eat tons of fruits and vegetables. My goodness, a ton of them. We have protein with every meal. They at least have to try a food. If they don't love it, that's okay, but you have to try it. And that's how we approach it in our house. The other thing I will say with that is, my daughter's in kindergarten. We go to a public school. We absolutely love our school. It's in a really small town. I pack her lunch most days, and she has requested to, like, once a month, can I get something from the school? And I'm like, sure, that's fine. So that's kind of my approach there, where I'm controlling the controllables and letting the rest go. The other question with this, my kiddos overall, was my approach to their health care. And this is another wheelhouse that we can get into the weeds with. My goodness. You know, as a medical provider, I am out of network with insurance because insurance really dictates care. It's unfortunate, but it does. I worked within the traditional medical system previously. As a provider, I get it. You have a set amount of time with your patients. You have to bill codes in a certain way so that the insurance will pay for the care. And I have seen that in bringing my kids to traditional medical providers within hospital-based systems that is covered by my insurance. They're seeing my kids for 15 minutes. They are pushing vaccinations. They won't have an open conversation with me about options for my kids' health outside of giving them an antibiotic or whatever it is that they're wanting to use to treat the condition, right? So I just found myself like kind of butting heads with the hospital-based provider approach. Not that they're bad, but being more open-minded to just having proactive health conversations, or how can we treat an ear infection with a more herbal-based approach, or how can we proactively support my kiddo's immune system knowing we're entering, quote, sick season, right? Just things like that. Like, I have things that I like to implement with my own kiddos. We use Beekeeper's Naturals Immune Support Spray. going back to nutrition, we eat very little processed food or things with added sugars, which I know is helping their immune system too. Going back to sleep. Sleep's a high priority in our household, so I know that's benefiting their immune system. But I want my healthcare provider to be a partner with me and to not feel like I'm bringing everything to them. So this year we did find a new provider for my kiddos in terms of their pediatrician. She's a nurse practitioner. She is local to us. She is out of network with insurance. I think to find anything that's a little bit more of that root cause approach, you do have to go outside of insurance-based care at this time. Again, that's why I'm outside of insurance-based care myself as a provider. There's so much red tape. And I know that it can be hard as a consumer, being on it from the mom side with my own kids to be like, oh, then we're not using our medical benefits. But honestly, you still are. You can pay with HSA or FSA. So we as a family max out my husband's contributions to that through his work. And if you look at the breakdown of cost of care, it really ends up being a wash because in the insurance-based model, there are copays, there are deductibles, and the cost per treatment session is so much higher when you look at what is billed to an insurance company. So for instance, billed to an insurance company to see me when I worked in the traditional medical setting was $500 per hour session. I charge $150 per hour session in our private practice, and you can use HSA or FSA, and then you can submit it to your insurance for reimbursement. Patients are typically actually paying less when it's out of network with insurance and where you just pay like the cash pay rate than somebody who accepts your insurance. But I know it's just like rewiring how you think about it. So I get it. Again, I'm in it from a mom standpoint, but I really ripped the Band-Aid off this year and was like, gosh, we're going to the providers that I feel like are giving us the best care. And I don't care if it's in network or out of network. And what I'm finding is out of network and just cash pay actually does end up being less most of the time. The other thing with that, like we used a home birth midwife for our first kiddo and it was a flat pay rate. But again, that amount ended up being less than what we would have paid if we had a hospital-based birth. So it's just rewiring how you think about things. And I know that sometimes it can be a hard conversation to have with your spouse if you're seeing things differently, but just continuing to have those open lines of communication. And you know in your gut when something doesn't feel right, when you need to switch providers. And we made that switch this year and I couldn't be happier. So overall, from a healthcare standpoint, as mentioned, I'm taking a very integrative approach: nutrition, sleep, nervous system regulation. That's something I didn't really mention yet, but things like dimming the lights in our house to only have like lamp light as the sun is setting. First thing in the morning, same thing. We're just having lamp-based lighting. So it's not this shock to the cortisol response with bright light right before bed or when you first wake up in the morning. Other things I'm doing to support their nervous systems is like cueing deep breathing when they're really worked up, doing stretches or mobility exercises with them. They see me doing it and they utilize just like mirroring me and doing it with me. And that's been a fun thing to do as well. And I do want to say with that, using modern medicine when needed is absolutely appropriate. It's there for a reason. It's life-saving in certain instances. Absolutely. I just very much view it as something to access when needed, but not as a default starting point. Now, as we close, I just really want to say thank you for being part of the Holistically Well community, whether you have seen me as a one-on-one patient, whether you have joined one of my Holistically Well online programs, or if you're a listener and you keep coming back for more in terms of learning from me on the Holistically Well podcast, on my drkaylaborchers.com blog, or over on Instagram at drkaylaborchers. I do this for free. When it comes to this education, this is completely free and just out of the goodwill of wanting to make an impact. And the reason I do the work that I do as a mom is because of the impact. I know how much this work is needed. I have seen the lives that it has impacted and the difference that it has made. And that's why I keep coming back. So if this podcast has impacted you or your family in any way, please share it with a friend and leave us a review. It really helps grow the show, help more people get the assistance that they need. And again, I'm doing this for free for you. And so that is how you can help. If I've had people reach out and be like, I can't come in for one-on-one care or join a program, but how can I support your work? Leave me a review, leave the podcast a 5-star review, hit subscribe, share it, share episodes that impact you, that resonate with you in your stories. Share it with friends, and all of that helps spread the word. And so, if you haven't already, please do so. Share, like, review. And in the meantime, if you have any questions, feel free to drop them over to me over on Instagram at Dr. Kayla Porchers, and I'll be sure to get to them as we record this new set of episodes throughout the year, where you get short, actionable episodes mixed with longer deep dives to really cover our bases for holistic women's health. Thank you so much for tuning in, and until next time, be well.